watch numbers come in and come out and disappear. $55 million for the Bergen County Blue Laws. Nobody's ever given me an answer of how that just disappeared. So to sit here and say we physically can't find the money is plain wrong. Because I sat there and we got the scorecard from the administration. It's no different than every other year. Numbers shift constantly right to the final document is prepared. And I want $65 million to walk right down the street with no replacement. Very easily, we could have found a way to put $7.5 million into that budget document. Final thing I just want to say to my friends and colleagues on the other side of the aisle. I know many of you deep down want to vote for this and have the compassion to vote for this and know it's the right thing to do. Do the right thing today. Don't let politics get in the way.
The 17 members of the Republican caucus strongly support access to quality health care for the women and the children of the state who need it most. And we made history sponsoring the state budget from the minority, closing an $11 billion deficit without raising taxes. We protected health funding for the most vulnerable women and children. We prioritize the continuation of the cancer education and early detection program, which provides mammograms for low-income women. We protected funding for low-income women and children with chronic diseases, birth defects, and special health care needs such as cystic fibrosis and prenatal care. And while we supported these priorities, 19 members of the Democratic caucus, the majority party, opposed the budget and the nearly $26 million in target funding for women and children. The proposed legislation before us would transfer $7.5 million in the state employees prescription drug program. According to the state treasurer, this transfer will put our prescription plan into a $5.6 million deficit and risk access to needed medication for women and children and the families of our rank and file public employees. Republicans responsibly projected funding for mammogram screenings and prenatal care in the budget. The budget that the Democratic majority opposed. Today, we support maintaining a balanced budget and full access to prescription medicine for families.
Fortunate that it was not included in our budget document. That said, at this point, we clearly can't spend money that doesn't exist. The source that we found, unfortunately, has not been identified as a source that we can't use. So I would like to offer and suggest another source of funding. I'd like to suggest that we take a look at increasing our own contributions to our health plans in the coming year and use that savings as a way to fund family planning in the coming budget, because it is critical to me and to many of us in this room that women do have access to care.
Now, if in fact this money doesn't exist in that line item, why has the treasurer not come forth? His answer to me, I read to all of you, unaudited figures, speculative, therefore we can't release them.
Agree with the funding that we've proposed? Do the waiver. Secure the federal money. Stand with the women who need these services. Don't turn your backs on the women of the state of New Jersey. Don't say that women's health doesn't matter. So we will be hearing legislation in the Assembly and Senate in the coming month, and in the Assembly I am here to tell you that I expect that we will be voting on this on October 25th on these two pieces of legislation that will go back to the governor's desk, and we'll ask him to take action again.
You know, I've heard a lot of debates on, I've heard a lot of stuff in Trenton since I've been here. That's some of the biggest baloney I ever heard.
You weren't pointing at me.
No. The worst part is, sometimes people stretch the truth. That's just a flat out lie. People aren't being honest here. The money's here. When they say it wasn't included in the budget. Neither was the $5 million Senator Doherty saw at the end and was holding up the budget. Neither was all the other money that was discussed that was in the budget. It's a $29 billion budget. And to use, honestly, a lame excuse that we couldn't find it is really disheartening. And for the women in the state, and men, they should have real concern. They should have real concern because this is strictly about health. It's not about abortion. It's not about any other issues. It's about health for men and women. And we're going to pay the price when they come to the hospitals, and we have to carry that load. So, Senator Weinberg, I can't wait to move this legislation forward because we're not going to stop until he signs it because this is wrong. It's not right to the people of New Jersey.